Let's go, studio. Thank you so much. Que hora es en espagnol? Son las 4:04. Quelle heure est-il en français? Il est 4:04. Hiện tại, thời gian là 4:04. What time is it in English? 4 minutes past 4 o'clock in the afternoon here at Mango Hall Basic School in rainy Mango Hall, Little London, Westmoreland. Have you had a checkup lately? If not, now is a good time. Let's not wait until we get sick to get a checkup. How about that? Checking in with another member of the team of volunteers of JAHJAH Foundation, Jamaicans Abroad, helping Jamaicans at home. She's Dr. Jacinth. That means she's Jamaican. If she says Jacinth, she's Jamaican. Because if she were American, she would say Jacinth, right? So she's Jacinth. Jacinth James, how are you?
I'm doing well, thank you.
Great, thank you so much for agreeing to speak with us. Let's talk about your Jamaican roots. Where in Jamaica are you from?
Westmoreland.
Sia, right here in Westmoreland.
Yeah.
Where?
Geneva, Grange Hill.
Geneva.
Yeah.
I didn't even know there was such a place. Geneva in Grange Hill. I know about Grange Hill.
Yeah.
But Geneva in Grange Hill.
Yeah.
Oh, look at that. Do you still have family there?
Yeah, for sure.
How far from here is that?
It's about 10-15 minutes.
Oh, so this is home.
Yeah, this is home.
Oh, wonderful. So it was a very easy task to get you to come here, right?
Sure, it was very easy.
Why is Dr. Dixon shaking his head in the negative?
It was very easy.
Well, tell us how you got in touch with Dr. Dixon.
Well, we met, I trained in the U.S. I did most of my training, actually all of my training in the U.S. And I went to work in Missouri. I think it was 2013, and that's where I met Dr. Dixon. We were working together in the emergency department.
I see. And at what point did you, I mean, if you had met him that long, why did it take you this long to come to Jamaica?
Oh, I was a little bit occupied.
Okay.
No, it's something that I've been intending to do. I think Trevor told me about the JAHJAH Foundation the very first day I met him. And I've always, admired his efforts. And, because of time in life, I haven't had the opportunity to come, but this year I made it a priority. Yeah.
And what has the experience been like? What are some of the ways in which you've been serving as a volunteer with JAHJAH Foundation?
The experience has been great. I think mostly I enjoy, educating the people. I feel like people are interested, the people that I've been seeing, they're interested in their health care. And while a lot of treatment wasn't taking place, on the sites the last couple of days, we were able to educate the people and answer their questions and, help them with some preventative medicine.
Yes.
Yeah.
And for you, how does this make you feel? I mean, it's one thing to give back at the urgings of someone else or being invited to give back, but personally speaking, to come back to your parish of Westmoreland, here at Mango Hall Basic School, just 10 minutes from where you're from, Geneva in Grange Hill. How does that feel?
It actually feels like it's a dream that's been fulfilled. When I was in kindergarten, I had a classmate of mine who died, and it was my first encounter with death.
Wow.
And, there was talks that if he had gotten to the doctor in time, he would have been, he would not have died. And it was when I made the decision to become a doctor. So I think I was about 4 years old at that time. And so it's been something that's propelled me, becoming a doctor has been challenging, but it's always been my intention to give back because, this is where my dream started. So, I was very grateful for the effort to be, for the opportunity to be able to give back in this way. So it's actually been like a dream fulfilled, and it's made, the hard work that I did in school and all that, it's made it worth it to be able to do this. Yeah.
And these days you live in a place where you would wish you would have at least the rain that we're having now, right?
I was really happy to get out of Toronto. A few days ago, we had like 10 inches of snow overnight. Ouch. And it was freezing cold, so yeah.
I won't ask you when you're going back. Enjoy while it lasts. Dr. Dixon, you want to come in here? Marcia says, well done. And she's giving you the fist there. There's a fist. Marcia says, yes, sis. Right.
Dr. James has been a little bit modest, as she always is. You know?
Yes.
Dr. James is one of our lead lecturer at the Kingston Public Hospital and the JAHJAH Foundation's ultrasound conference. She's one of the lead lecturers, and she did a fabulous job.
Indeed. Well, thank you for doing the PR for her, because she's not PRing for herself. By the way, Steve in Toronto, Canada says, Westmoreland people look beautiful, eh?
Thank you, Steve.
Yes.
All right. It's been a pleasure. Thank you so much. All the best.
Thank you.
That's Dr. Jacinth James. Lyndon Williams is with me now. You've been hearing his name all week because we've been calling Dr. Dixon every day. Every day, and Dr. Dixon does an interview. He calls his long list of sponsors, partners, supporters, and Lyndon Williams of Maxi Department Store is always on that list of names called by Dr. Dixon. How are you?
Good afternoon, Dervan. Good afternoon, Jamaica.
Great, thank you so much. And a little birdie tells me you not only ensured that Maxi was on board, but you yourself on a personal level made sure to make your contribution, and we want to say thanks. I don't think you want everybody to know that necessarily, but we had to say that. But let's talk now about your support for the JAHJAH Foundation, which was founded by Dr. Trevor Dixon. You've been supporting JAHJAH Foundation for some time now, right?
Yes, very long time. I actually forget how long it's been. I was just asked that question a while ago. It's like, how long has it been? It's like, okay. Trevor got married in whatever, and it's like 2000 whatever, so it's like maybe a few years before that. So it's around 2003, 2004.
Yes. And that encounter was here in Jamaica or in the States?
No, this was definitely here in Jamaica. Yeah, you got his inspiration, I think, in my home. I think.
Tell us more. Come on now.
Each year the story just gets better.
All right. Okay, spill the beans. Tell us.
Oh yeah, I mean, he came down and he just got inspired to go down to KPH, and he's like, well, let's go down. I drove him down there, and that's where it all began. He just like, I got to do something. Yeah. Right? And then he just sort of wrote me in each year. Each year is like, okay, then let's go here, let's go there. It's like, okay, all right, sure.
And so you've been a very supportive and cooperative friend and colleague.
Absolutely, yes.
Yeah.
Yes. When Trevor asks for something, like, okay, Trevor, sure. Well, Trevor and Karen, actually.
Oh, to the hard way.
Yeah, Karen just jumped on board and starting to push me a little bit more too.
Now, you're also obviously associated with Maxi Department Store. I know the one in Maypen, Clarendon. Where are the others?
The others are, let me see, Montego Bay, Santa Cruz, Mandeville, Portmore, Kingston Springs Plaza, and Ochoas.
Yes.
But in Mississippi.
Halfway tree.
Halfway tree, yes. Springs Plaza, halfway tree.
Yes. And remind us of the nature of the items that people can get at Maxi Department Store.
You can get ladies and men's and children's clothing, shoes, home decor, a lot of different things, costume jewelry, perfumes, everything. Khaki uniforms, bags,
Oh yes,
handbags.
you're famous for that. Yeah, back to school time, Maxi Department Store is usually humming.
Very, very humming. We are the #1 provider of khaki in Jamaica.
Yeah.
Every Jamaican has something.
Pretty much, yes.
Yeah. You would be one of those who would assist Dr. Dixon in encouraging others to come on board, supporting the work, because people tend to take it for granted. Okay, these are Jamaicans overseas, they must have money, and so they're coming to Jamaica with a bag of money, and so they don't need any help from anybody on the ground. Far from the truth, right?
Yes, far from the truth.
Treasurer, he was known.
No, I mean, this work is extremely important. Someone gave me a statistic that, well, there's a push by the Ministry of Health right now to adopt some clinics this year, and they've identified 100 clinics that need adoption. I mean, when you think about it, that's a lot of clinics. I mean, when I talk to a few of the dentists here, the amount of need in terms of dental care that's necessary, the amount of healthcare that's necessary, just primary healthcare is necessary here. And I mean, we are not a developed country. We try with the best that we can with the resources we have, but we need more. And that more can only come from those who are of, well, not only those, but it should really come from those of Jamaican heritage. And, you know, that it should be from us, whether it's abroad or local.
Yes.
And this is why I'm here. I mean, I recognize the need. I mean, granted, I have a friend that tells me what the need is and what the issues are, so I have a sort of a different perspective on things.
Yes.
But when you do hear the stories that hospitals do not have basic things such as blankets, do not have basic things such as hospital beds, don't have the defibrillators that they need to save a life, you kind of get like, okay, we've got to do something.
Yes.
Something has to be done. You know, so I do definitely encourage people to try to donate, whether it's, I mean, please donate to a JAHJAH Foundation, but whichever charity organization that helps.
Yes, indeed. And finally, you have served in several ways with JAHJAH Foundation, because I hear you're a former treasurer.
Yes, I am. Yeah.
He doesn't have any money.
Well, there's always a need.
Yeah.
All right, there's always a need. So as I said, I do encourage everyone to try to pitch in to help.
Yes.
Help yourselves.
Yeah.
Right? Because you never know. You know, this could be your cousin, it could be your auntie, it could be your grandmother, it could be your brother, sister that we do help and save a life.
Right. I'm going to have a word now with a lady, I'm told, who is very involved, and she has more than just a passing knowledge of this parish here, Westmoreland. She is Dr. Dixon. You want to introduce her especially? You seem anxious to do that, so I'm going to let you do that.
Dervan, I want to introduce Miss Jean Powell, RN, and lots of other letters behind her name. And she can tell you about all those letters, about 15 letters after the RN. She's out of downstate Brooklyn, New York, and she was able to garner so much sponsorship from the Savlamar, Little London area just by her name in the area. She's from the area. She's a child from the roots and a child from the soil of Westmoreland. So she can tell you more, but I just want to give a big shout out to her. She stepped up on board. She came on board late, but nonetheless, she knows it takes cash to care, and she was able to garner lots of funding so we could make this whole mission a success.
Well, thank you for that introduction, Dr. Dixon. And so now let's learn more from Jean Powell. Nurse Powell, how are you?
I'm fine, thank you.
Good, nice to talk to you. Tell us about your roots here in the parish of Westmoreland.
I am from Savlamar proper. I grew up on Rickett Street. My parents are from Savlamar via Darliston and Sheffield. So I am Brooks and I'm Johnson. And I grew up in Savlamar, like I say, proper. I left Jamaica 44 years ago, but I am a Jamaican. I am here. I normally here 2, 3, 4 times a year if I can. And I believe in healthcare. I'm a healthcare provider. I'm a practitioner. I'm also a consumer. So healthcare is my thing. And when I was asked about 2 weeks ago at the OID function.
OID?
Yeah,
What's
at a
that?
function. Out of Bronx, New York.
Okay.
And the Dr. Street. And said JAHJAH Foundation is coming to Jamaica and they need some help, and I jump on board. And you know, like I said, I believe in providing care and giving care. I know the needs are here. I know the resources are scarce. So I garnered some resources from my sister and I have a co-worker here with me, Miss Ann Ellis, who is also a critical care nurse from SUNY downstate. And we were right on board and we came down. I spoke with Karen a couple of times and got some stuff moving and shaking before they came down. And thanks to tents and events with Douglas Arnold for his support right away.
Yes, man, call names, by all means, call the names.
Yeah, you know, Mr. Arnold did not even falter. He said, this is what I will do, this is what I will give you, and you know, he was right on board. Even this morning we needed an extra tent, and the tent was here. You know, so we have to give back to our community. To whom much is given, much is required.
Yes.
You know, the Creator has helped us to reach as far in life, and we have to give back. I am a product of Godfrey Stewart.
Ah, okay.
Godfrey Stewart.
High
It
school.
was it was junior secondary at the time.
Okay.
So I am a product of the old Godfrey Stewart school. So I know what it is about resources and giving back. I have been giving back to Savlamar Hospital over the years and other places. But this foundation, I am telling you, the short time that I have, it's 2 weeks. It's 2 weeks, really. And to come here and see what they have done, it's amazing. So people, don't be afraid to give because your money is not being squandered. Give to JAHJAH Foundation. And it's amazing because I speak to people in Savlamar and they have no clue what JAHJAH Foundation is. So it's about advertisement. So we have to put it out there.
Exactly, which ties into the point I was making earlier on about marketing. It's one thing to be doing great work. If nobody knows about it, then you perhaps can't do more. The more people know about it, the more you're likely to be able to do, and the more you learn about more causes that need to be pursued. We want to just thank you for your commitment, your own commitment, and not shaking the dust off your feet. Because some people leave and they shake the dust off their feet and they don't want to have anything to do with that place down there anymore. Obviously.
I love this little island on the rock.
Yes.
And nothing is going to keep me from not coming. I am home.
Yes.
Okay?
Yes.
And that's all there is to it.
Indeed.
Okay?
Great.
And I will be harassing my co-workers in New York and family members to support JAHJAH Foundation and do what we have to do. It's going to be one school at a time or one community at a time.
Well said.
All right?
All the best.
Thank you.
Good. Take care. Nurse Jean Powell, originally from right here in Westmoreland. Both sides of the story is the story of Jamaicans abroad and Jamaicans at home, and what can happen when Jamaicans abroad work with Jamaicans at home. But we do recognize that important category, Friends of Jamaica. Now it's important, to the point we made earlier on, that some people think that they're coming from foreign, so they must have only per month. No, they need support on the ground. And we have a gentleman here who has been supporting the team on the ground, Douglas Arnold from Events, Tents and Party Rentals. Good afternoon, how are you?
I am pretty good, thank you.
Great, and where's this place located?
Samanalama.
Right.
Barry James Plaza in Savannah.
I see what you mean, Mr. Douglas. Tell us now about the nature and extent of the products and the services that you provide at Events, Tents and Party Rentals based at Barry James Plaza in Savlamar.
Well, we're a small rental company. We do tents, chairs and tables mostly. We supply Westmoreland and sometimes a little bit out of town. But we're called upon to help. We're small, but we're called upon to help. And we see the need. I am in fact a rotier and also a businessman, so I kind of know what it's like to work with organizations like
JAHJAH Foundation.
Yes.
I see. How big a function can you cater for? In terms of your chairs, your tents, what's the biggest one you've done so far?
The biggest thing is the Westmoreland Curry Festival.
Oh, I haven't done that one in a while actually. Did they have one last year?
Yes, they did.
Yo, I'm not sure where I was, but I missed that one. Right, so you're responsible for those tents?
Yes.
I see. And does it matter the size? Well, that's a big one for sure, but how small an event do you cater for?
Well, one chair.
All right, I must remember that. Next time I'm in Westmoreland and I'm short of a chair, I'll just come to Events, Tents and Party Rentals. How busy have you been? Because that gives us an idea of the nature of the interest and the party circuit here in Westmoreland in particular. How busy have you been in Westmoreland?
We're very busy, especially in the holidays. We're busy for Christmas,
Yes.
over Christmas season, Easter holidays, we're very busy. It's not very busy right now.
Right, but this is usually what they call this tamarind season in Jamaica. Yeah, tamarind, dry season, so to speak. But talk to us though about the arrangements that people have to make, because people are planning events. Some people at the last minute they think, oh no, we need to get a tent because the Met office says it's going to rain or something like that. What's your ability and your capacity to respond at short notice to these requests?
We get a lot of that. We don't like that because you end up turn up somewhere late, and you don't want to look like you're, for example,
Unprofessional.
late. Unprofessional. Yes, that's very hard. But I have customers and they're regular customers, so I have to rise to the target. If they say come now,
Yes.
we have to just go now.
Right, and you don't just back the truck up and empty it off with the tent and move away. You actually put up the tents yourself?
Yes, tents we have to erect ourselves.
Yes, right.
And there are some people who want to do a setup. We have to go put up the tents, set the tables, set the chairs. We do that upon request.
And people might want to know now in terms of the nature of the events. I know you mentioned the Curry Festival. What about weddings?
Yeah, a lot of weddings, a lot of parties, a lot of
Repasts.
Repasts is
Yes.
a big thing, yes.
Yes, I see. But do you get involved in catering, or is there strictly tents, tables, chairs?
No catering.
Yes.
No catering.
All right. All right. Leave some numbers. I know you're at Barry James Plaza, Savlamar. So those who are listening to us right here in Westmoreland, elsewhere in Jamaica, who would need your services, what number can they call?
955-2975, and the mobile is 846-5717.
Sounds good. Thanks, Mr. Douglas. All the best, and thanks for supporting the work of JAHJAH Foundation.
You are most welcome, sir. I was happy to.
Indeed. Que hora es en español? Son las 5 menos 26. Quelle heure est-il en français? Il est 5h moins 26. Tietsai, Tidien le, Wu Dien, Cha R Shi Liao Fen. What time is it in English? 26 minutes to 5 o'clock in the afternoon here at Mango Hall Basic School in Little London, Westmoreland in Jamaica, wherever in the world you are listening to us. Do you know where your children are? Are they where they're supposed to be? Doing what they're supposed to be doing? It's a good time to check up on the children. A good time for us to continue our broadcast from Mango Hall Basic School. We're here at the behest of JAHJAH Foundation. Jamaicans abroad helping Jamaicans at home, led by Dr. Trevor Dixon. We're getting a lot of feedback coming through from all over the world. Perhaps a little later on we'll go to some of the messages popping up. But right now we have another member of the team, Dr. Jeffrey Kim. Dr. Kim, how are you?
Doing very great. Thank you for asking.
Right. Where are you from, Dr. Kim?
I grew up in Philadelphia, in Pennsylvania, but I live in New York now, and I work with Dr. Dixon.
Oh, so you really didn't have a choice then? Or did he have to drag you kicking and screaming to come to Jamaica?
I had little choice, but I really wanted to be here as well. It's a great learning experience, and I'm loving Jamaica so far. So, yeah.
What's your area of specialization?
I'm an emergency medicine doctor.
Wow, that can be quite traumatic. We talk about trauma a lot. We talk about people who are impacted by trauma directly. And sometimes we forget that those in the medical field and the health services in general must be quite traumatic for them too, having to deal with these patients, having to care for them, and every now and then, a patient or two doesn't make it. Give us a sense of that whole experience for you.
I think with emergency medicine or medicine in general, you choose your specialty based on your personality. So it takes a certain personality to be, objective and calm in an emergency room.
Yes.
I think Dr. Dixon is a good example of that, and I feel like I'm within that category as well. The time that it's like really traumatizing for me personally is when a young person passes away, and you don't expect it. And you see that often in trauma settings, in motor vehicle accidents, and gunshot wounds, things of that nature. But other times you have young people with an obscure disease that could cause them to pass in the emergency room. So that's always very difficult. It's always very difficult to see them with their family members there, and they're all crying, and you gotta console them. So it's definitely a challenge, but at the same time, with high risk, there's high rewards. So a lot of what we do, we're saving people's lives and making an immediate impact. So
Speaking of impact, of all the activities you've been involved in, the outreach you've been involved in, which one stands out for you so far and why?
So, we're doing so many different things here. We got dental here, we got health clinics, we're trying to promote education. But the thing that stands out for me and the thing that I was most involved with was training medical professionals here on how to use the ultrasound machine. So, you know, in medicine, there's a lot of different imaging modalities. You have CAT scans, MRIs. Those are very expensive and oftentimes inaccessible. But there's a machine called the ultrasound, which is cheaper, which oftentimes does a better job than other imaging modalities. But a lot of people don't know how to use it that well. So, you know, I'm here with Dr. Dixon, who's specially trained in using the ultrasound machine and teaching medical professionals, leaders in this country here, how to use this tool. And they could pass on that knowledge to other people. So it's sort of a way to kind of not only impact a few people, but the entire country as a whole.
With all the work you've been doing, have you had any time to enjoy Jamaica as a tourist, so to speak?
So, you know, we got a chance. We do something called dancing or healing on the dance floor, a dance hall on Uptown Mondays in Kingston. Right? And it was my first experience doing like a dance hall event.
Yeah.
And it was sort of an eye-opening event, but I loved it. You know, I love the music.
Eye-opening and eye-popping too.
Eye-popping as well, exactly. You know, lots of things were blown at that time. But, you know, it was a great experience. And I love the energy. I love the vibe. I like, you know, the people there were great and they're so welcoming. So, you know, another reason to visit Jamaica, I suppose.
But of course. And are you looking forward to going back home?
I'm not. You know, so my plan is I'm going to stick around for a few days after the mission, just to kind of venture out on my own and check out Jamaica myself.
Excellent. Well, we want to thank you for the work that you've been doing as part of the team of JAHJAH Foundation. Well done, and we look forward to your returning to Jamaica and giving back once again.
Absolutely. I'll be here next year.
All right. That's good news. Thank you.
Thank you.
Great. Take care. That's Dr. Jeffrey Kim. And joining us now is our next guest, and she is Joan Rose Green. Nurse Joan Rose Green, good afternoon. How are you?
Good afternoon, I'm fine, thank you.
And tell us about your Jamaican connection.
I grew up in East Kingston.
Okay, yeah. Where did you go to school?
I went to Kingsway High.
Oh, right, I know Kingsway. Yeah, yeah. And left Jamaica after high school, or?
I did college here in Jamaica, and immediately after college I migrated. So I've been living in Brooklyn, New York for the past 33 years.
Wow. How often do you actually get to come back to Jamaica?
Not very often. Most of my family members are there, but I do have a brother here. I was here in June and I came back this time of the mission for the first time.
So you were here in June on your own vacation,
Yes,
eh?
I took some friends with me.
Oh, lovely.
Well, of course I like Jamaica.
Yes. Well, that's wonderful. And where did you spend the time in terms of which
We're
resort?
at the Rio Montego.
All right. So you were in the friendly city?
Yes.
Indeed. All right. And so you decided to come back with a mission. Oh, lucky you. How did you hear about the mission though?
I'm an emergency room nurse, and I met Dr. Dixon about 3 years ago when he took his mother-in-law to my emergency room that I work in. And last year they a part of the Jamaican nurses group, and they were honoring him there, and I just went up to him and I said, I want to be a part of your foundation, and I just hopped on board. That was November, and here I am.
Oh, that's quite a story. And how has the experience been like for you?
Well, I'll tell you this, it has been quite an eye-opening experience for me, because just the fact that I'm here and giving back to the people, I realize that there's a lot to be done in the community, and there's a lot more that could be done here. The resources are limited, so it's an eye-opening experience for me, and it has taught me that I could be more appreciative of the things that I have, because a lot of people here do not have the resources like we have. So yes, it has been quite an experience for me. I mean, helping, especially the children at the Irish in the school, I enjoyed that immensely.
Wonderful. Well, it certainly is a pleasure to speak with you. We thank you for volunteering your time and energy and resources in supporting the work of JAHJAH Foundation and reaching out to the people across all the areas that you've been serving here in Jamaica. We're proud of you as a Jamaican, and we hope that you'll be able to bottle up as much of the warmth here to take back with you to New York.
It's very cold there now. I know it is. I'm not looking forward to going back. Unfortunately, I have to go back. And of course, my experience here at Mango Valley today was really good.
Mango Hall, yes.
Mango Hall.
Yes, yes.
I'm sorry, Mango Hall, yeah.
Indeed.
I'm putting in my own names. But overall, it has been a tremendous experience, and I've enjoyed it very much. And I am anxious to participate more and be more involved in this foundation. I think it's a wonderful, wonderful effort and work that everybody is doing to help the communities that they've been in.
Okay. Thank you so much.
You're
all
most
the best.
welcome. Thank you.
Take care. There you have it. Another Jamaican who is a part of the mission team of JAHJAH Foundation, Jamaicans Abroad Helping Jamaicans at Home, Nurse Joan Rose Green. We're up on another break here on both sides of the story, Power 106 FM, and we're getting a lot of feedback. Marcia says thank you for your contribution. She says big up Trelawney, and so on. Well, Marcia is asking, how do we get involved? Well, you can start by going to the JAHJAH Foundation website, jahjahfoundation.org, JAHJAH.org, and just keep hitting the donate button until you feel like stopping. How about that?
Oh no, never did.
Let's go, studio. ¿Qué hora es en espagnol? Son las 5 menos 12. Quelle heure est-il en français? Il est 5 heures moins 12. 现在几点了？5点12分. What time is it in English? 12 minutes to 5 o'clock in the afternoon here at Mango Hall Basic School in Mango Hall, Little London, Westmoreland. Wet conditions, but we are as dry as chip, as my mother would say. We're here in support of the work of the JAHJAH Foundation, Jamaicans Abroad Helping Jamaicans at Home. Joining me now is Dr. Javier Johnson. How are you?
I'm doing awesome. How are you doing?
I am fine, thanks. So, Dr. Johnson, is it that you've always wanted to be a dentist?
So honestly, I didn't find dentistry until like my sophomore year of college. And so I always knew that I enjoyed helping people and wanted to do something in medicine. And so it wasn't until my sophomore year that I had an opportunity to really kind of explore the dental field, and it was just a perfect fit for me.
Yeah. And how did you meet Dr. Trevor Dixon?
So actually, my wife is a dentist as well, and her and Dr. McLean had done some previous mission work together. And so actually last year, my wife was invited by Dr. McLean, who knows Dr. Trevor. And so through that connection, both my wife and I, who's a dentist as well, we become a part of the program.
Yeah. And how have you found your work here in Jamaica? What has the experience been like serving with JAHJAH Foundation?
Oh, it's been awesome. Just for the opportunity to be able to meet so many great people here in Jamaica. I've traveled to Jamaica before, but it wasn't until I started actually doing outreach here that it really kind of took another spin for me. So it's been great.
Yeah, wonderful. Is there anything that stands out for you in terms of out of all the experiences you've had so far here in Jamaica?
Yeah, so my practice nowadays is specifically kids, even back home in the U.S. And so being able to treat the kids, because I feel like if we can catch them early on and at least change the habits, teach the parents on how to properly care for their kids' teeth and make it a part of their daily routine, we can change the next generations. And so I think that the best treatment is prevention. And so tooth decay is one of the easier things to prevent just by simply brushing and flossing, taking better diet habits. And better diet habits actually affect the rest of the body too, because the mouth is connected. And so we never want to forget that. So it's treating the kids has been by far some of the biggest things that I really appreciate.
Excellent. Well, we appreciate the work, or as the Rastafarians in Jamaica say, appreciate love, because we're not into the hate thing. Appreciate love.
That's right.
All right. Well done.
Thank you. I appreciate it, Dervan. Thanks.
All right. Good. Take care.
All right. You as well.
There you go. That's Dr. Javier Johnson. This is, I remember Andy, a director of JAHJAH Foundation. How are you?
I'm doing good. I'm doing good.
Wonderful. How does this year's mission compare with previous missions you have been involved in? Any noticeable differences?
The noticeable difference is that we definitely got more done when it comes to the dental area, because we had 4 great dentists working with us this time around. So we got through a lot more patients than we normally would this year.
Oh, good.
Also the health fairs, they went a lot smoother, because by going each year we get a little better.
Yes.
And now things are moving a lot smoother based on our experiences.
And what about the reception on the ground in terms of how people have received the JAHJAH Foundation as you have moved from community to community, from place to place?
So from place to place, we definitely have a great turnout. A lot of people, they heard we're coming, because we did spread the word before we got here, letting people know we're coming. We spoke to the community leaders, teachers, and churches, and they did make a little announcement, so they know we're coming, so people are ready and waiting for us to come to help them out.
Nurse Bridget Doyle. Sorry, I have in the earplugs and I'm not hearing so well. Nurse Doyle, how are you?
I'm fine, thank you.
Okay, good to talk to you. Is this your first time to Jamaica?
No, I was born in Kingston,
Really? Where in Kingston?
Waterhouse.
Waterhouse. Hello to the, well, technically speaking, that's St. Andrew, but it's okay.
Yes.
Kingston and St. Andrew were merged administratively back in 1923. I think it was.
Before my time.
Yeah. Indeed. So hello to the people of Waterhouse. This is one of your own.
Yes.
Nurse Doyle.
Yes.
Tell us. Where did you go to school?
I left there when I was 10 years old. So I went to Constant Spring All Age School. Hello, Mr. Jones, if you're still alive. That was my principal.
Yes.
And I migrated in 1974 to the U.S.
Straight to New York?
Straight to Bronx, New York. Yes. Yes.
And at what stage did you determine exactly what you wanted to do in life?
Well, before I became a nurse, I worked on Wall Street for about 20 years.
Are you kidding me? Some people are listening and going, you gave up Wall Street for nursing?
Yes.
Why?
More satisfying. It's more about connecting with people, and I come away with a better type of satisfaction each night. So currently I'm working in the emergency room in Newark, in New Jersey, where I now reside. And so in trauma and emergency, you are the first person that they see, the first person to intervene and to get the patient stable.
And what now of your experience here on this mission trip? How has this trip been so far?
First of all, it's just such an eye-opener, that the need is here. When we went to Trelawney, I was just amazed to see so many people waiting in line to see us for so long. And it's a small impact, but it's an impact that we're doing. And healthcare, taking care of our own, is important.
Indeed. Well, welcome home and continue to give back. Well done.
Thank you so much.
All right, good. Take care. That is Nurse Doyle. Right, Dr. Trevor Dixon is going to help us to wrap today's edition of Both Sides of the Story here on Paro 106 FM. The story of Jamaicans at home and Jamaicans abroad, and what can happen when Jamaicans abroad work with Jamaicans at home. Dr. Dixon, we need you now just to give us a summary of this trip, this mission trip, an opportunity again to say thanks to some key individuals and remind us of the 2 fundraisers that we need to look forward to so people can mark the dates from now to support these events, and if they can't support them, they at least can go on your website and donate.
Yeah, thank you, Dervan. First, I want to say that we really, really need you to support the JAHJAH Foundation as we try to uplift different areas in Jamaica. Here we are at Mango Hall Basic School in Little London in Westmoreland, and here we are trying to provide health care for the community. And we're only here for one day. And we
as in here in Mango Hall in Little London for one day, but obviously you've been here a whole week.
Yes, what I'm saying is that we're only here at Mango Hall for one day, and we have no electricity. I can't imagine these students have to go through a whole school year without having electricity, to not only to We're not talking about for computers here. We're talking to be able to read a book. Okay? So definitely these children are going to end up having vision problems, frustrating their eyes, trying to see when the light isn't adequate. So please support the JAHJAH Foundation as we try to uplift Jamaica. Many times you say, I'm not going to give to charity because we don't trust these organizations. We are here in Mango Hall Basic School. We have started tiling the floor. We have started refurbishing the kitchen. And if you don't believe me, just come down here and see for yourself. We need your support. We need to ask other people besides our sponsors. Max's Department Store, thank you for supporting us. The Boardwalk Hotel, thanks you for having us at your place this whole week. Events, tents, and party rental in Barry James Plaza in Savannah, Lamar. We want to thank Kisses Wedding, Rental, and Catering. And we also want to thank Colgate. We want to thank all our sponsors. Mr. Lyndon Williams from the Max's Store stepped up personally and donated. So we ask all Jamaicans to please support the JAHJAH Foundation. Thank you, Power 106, for being on board. Gene Powell, thank you also. Truck Stop in Kingston, Truck Stop Grill and Bar, and Colgate for supporting us. Thank you for all the supporters. Love you, JAHJAH Foundation. See you next year.
Thank you so much, and all that's left for us to do is to thank Dr. Dixon and his team for the tremendous work they've done. Thank you to our broadcast engineer on location, Alte Hilton. Thanks to the team in the studios of Power 106 FM. Thanks to you, our faithful listeners at home and abroad, for making it Both Sides of the Story. All things being well, Both Sides of the Story returns Monday afternoon, 2 to 5. Till then, this is Dervan Malcolm reminding all of us that every day is an opportunity to do better than yesterday. Have a great weekend.